Hey everybody, Dr. Danielle Ward here, and I am coming back to you all today with Plastic Surgery Education Series. Want to talk about liposuction. Now, I know I said I wanted to, mostly focus on education of plastic surgery items like hand, craniofacial, like the things that the general public doesn't know that we do as much of, instead of the aesthetics, because most people just see plastic surgeons as doing lipo and tummy tucks all day. But recently I had a medical student with me who, we were doing a liposuction case. I told the student, make sure you go ahead and read on lipo and the complications and everything before the case. And the student, said that they had watched my flaps video and that, it would have been really helpful to have something on liposuction. And it's funny because to me, I think of lipo as, everybody knows what lipo is. Oh, you're just sucking out fat. But dealing with patients and students and everyone, I realized that people really don't know the intricacies of liposuction. So this video will be to explain exactly what liposuction is. I'm going to talk about BBL because you can't talk lipo, especially being in Miami, without discussing the BBL. And I'm just going to clear up a few things, have an educational component, but this is not going to be extensive. It's just, to educate the public and the students watching. Thank you guys for watching. So stay tuned, and this is Plastic Surgery Education, a liposuction, and BBL. What is liposuction? Well, it's exactly what the name implies. Lipo is as in fat, and suction as in sucking it out. So basically, it's when we take a cannula and we insert it into the body to remove areas of unwanted fat. So it's not limited to just the abdomen, as most people think. You can do arms with like brachioplasty. Some people have extra fat in their lower chin area that they want removed. I deal with female patients who want like that bra bulge removed, back fat removed. So basically, you can lipo pretty much almost anywhere in the body. There are what we call zones of adherence that you have to follow. So you're not going to do like the distal iliotibial tract or like the gluteal crease. I'll put up a picture so you could see like the zones, but there's certain areas that we don't violate because that can cause what we know as contour irregularities, but I'll get more into that later. But to know what liposuction is, it is just sucking out fat from the body. And then when we talk about BBLs, I'll explain that process to you as well. That'll be the second half of this video. So how does liposuction work? So in a nutshell, you're basically infiltrating tumescent solution into the body. That blows it up. Then you're inserting a cannula, and then there are multiple techniques that are used to remove that fat from the body. So when I talk about infiltrating, so a lot of times we use what we call a wetting solution to kind of blow up the fat cells and make them juicy in a sense so that we can suck them out easily. Now, some people do this. We typically do this with a bag of saline, epinephrine, but some people will use lidocaine with it, which is just like a local anesthetic, a numbing agent. But I think the most important part is the actual technique used for infiltrate. So something that we get asked on our plastic surgery in-service exam nearly every year is to differentiate between the different techniques. So there's dry, where you are pretty much not using any wetting solution. You're just going in there and just sucking out fat. That actually results in the greatest amount of blood loss. And personally, I've never done dry technique. I mean, I don't know anyone who does dry technique. But the other technique that you can use is what they call wet technique, where you just insert 100 to 300 cc's into each area that you plan to suction out fat. And no matter how much fat you're taking out, you're only doing 100, 300 cc's of that wetting solution. So that's what we refer to as wet. The other one is super wet. This is a 1-to-1 technique. So if you insert a 1 liter bag of saline with epinephrine or whatever your solution is, or just wetting solution, and you are going to take out 1 liter of fat. If you insert 2 liters of fluid, you plan to take out 2 liters of fat. So that is your super wet technique. And then what a lot of people use is the tumescent technique. So if you hear me like say, oh, tumesce, that's what I'm referring to. And that is a 2 or 3 to 1 ratio of the wetting aspirate solution to a removal of fat. So a lot of people will usually go between tumescent or they'll do the wet. It varies, but that's really surgeon dependent. So that's going back to the technique. When you make your very small, like 1 centimeter incisions, where you want to insert your cannula, you're going to infiltrate with your solution. Typically, you wait about 20 minutes for, you know, the numbing and everything to take effect, and then you insert your other cannula in, and that will start the suction process. Now, there are actually multiple ways of removing fat. So sometimes you'll hear of suction assisted liposuction, where there's like a suction to help. Ultrasound assisted liposuction uses ultrasound vibration to break up everything, and it actually makes it easier for the surgeon to like get in there. Other ones, power assisted liposuction, so like there's this micro air that we use that just kind of vibrates and it just really breaks everything up to get that out. So there are different types of liposuction. I've worked with attending surgeons who have a huge Toomey syringe connected to like a hemostat, and that's like sucking out the fat as you're moving your arm. A lot of them like the power assisted liposuction with the micro air. I find that the vibration when you're doing like so much of it, it just like you lose the tactile sensation in your hands from doing that. So like for me, I do prefer just, you know, regular suction assisted liposuction without the fancy things. And then cannula wise, there's different types of cannula sizes. So I typically use like a 4 or 5. Mind you, I'm a resident, so I'm still like, you know, learning what I like and don't like. But, you know, the larger one gets more fat. The smaller one, you know, you have more ways of causing complications the smaller you go, and I'll get into that later. But I prefer like the Mercedes cannula and just kind of doing it. But I will be honest with you guys, liposuction for me is so labor intensive. It's probably one of my least favorite things to do, just because like you're breaking a sweat, you're in there, and I mean you're just going at it repetitive for hours. That's probably why I'm developing all these arm muscles now. But yeah, it's a lot of labor involved. So that explains why other surgeons like, you know, use things like the power assisted to kind of help them break it up. And you want to reduce fatigue as a surgeon, because there's when you're removing fat, you're there for hours and you're getting it all out. But basically, going back to the technique, you're infiltrating and you're sucking out the fat, or we do like, you know, separation, aspiration, fat equalization. There's like a safe technique that they talk about, but that's pretty much it for the technique of liposuction. So I think next I'll go into the complications, because that's something that a lot of people don't talk about. So let's get into the complications of liposuction. Right, so here's the thing with liposuction. Everyone thinks that liposuction is the easiest thing in the world. And when you get down to it, yes, you're making an incision, you're going in, you're trying to stay in the intermediate layer, just sucking fat out. But I feel like liposuction is one of the most dangerous things that we can do as plastic surgeons. So, I mean, I'm in Miami, you see a lot of non-plastic surgeons doing lipo, and I mean like, you know, internists, dentists, gynecologists, like all these family medicine, like everyone's doing liposuction, but not everyone really knows the full complications or how to handle these complications if they develop. And I remember my first year here, like first day, there was an ICU patient that we were helping to manage who had a diaphragm perforation from someone doing liposuction, non-plastic surgeon, and the cannula went right up to the diaphragm. So it is not without complications. And I think that's really important for people to understand, is like, you're sticking that cannula in there, you can perforate down to like the colon, the bowel, if you don't have the right technique, the diaphragm, heart, all of this is up here. And that's something, it's not the most common complication. It shouldn't be happening if you know what you're doing. But when people are just jamming it in and don't have that training or that knowledge to know, then that's where complications happen. And unfortunately, living in Miami and training here, where there are a lot of what we call chop shops, we do get to deal with a lot of these unfortunate complications from people who, went to surgeons who were cheap, played with their lives, and, have to deal with that. But that was just me rambling. I do get off on a big ramble. Let me get back to common complications of liposuction. So when we talk about common complications, there's something called like nepraxia, like not feeling sensation where you were lipoed. Typically, for a lot of these people, that resolves like 3 to 6 months as the nerve endings come back, but that is a complication to be aware of. Another complication is pulmonary embolism. If you are doing large aspirate or large volume liposuction, and for us that's classified as anything more than 5 liters, which every state differs, but in Florida we have laws on how much we can take out in an outpatient versus a hospital setting. But the more fat that you're removing, the more you are making that patient prone to developing a pulmonary embolism. So that would probably be the most common complication of just liposuction alone. Other things, contour deformity. So when I talk about that, the fat actually has multiple layers. So you have your superficial, the intermediate, the deep layer. You don't want to be too superficial, because that superficial layer is like tethered to the skin. So when you're putting that cannula there and you're in that superficial layer, it will actually cause divots. And that's what we call contour deformity, is when someone is liposuction, but it's not even, you see like lines here, lines there, someone like sucked out too much fat in one area, or they were too superficial in another. That is something that you'll commonly see. Now, I won't talk about like high definition lipo, but there's times when you want to be more superficial to create that abdominal etching layer, as we call it. But a lot of times you just want to remove that intermediate layer of fat, and so that it creates that smooth appearance that everybody wants. So contour deformities, that would be another one. A lot of women tend to get liposuction with abdominoplasty combined. Abdominoplasty is a tummy tuck, for those who don't know what that is. And so a common complication, the most common complication when it's combined with the tummy tuck, is what we call a seroma. And a seroma is just fluid buildup underneath, and that typically needs to be drained, and that can also affect the appearance. So of course it'll look like bumpy, you'll have a fluid shift. So that is another complication that happens. I don't know if I talked about the ultrasound assisted liposuction. We typically use that when we're doing biopolymer removal, but it oscillates so fast that it can actually create like burns to the skin. So when we're using that type of lipo, we are very careful to protect the skin, even where we're putting in the ports. So thermal burns is another complication. And then there's fat embolism that can occur, and we actually typically see this more often with BBLs, which I'm going to go into in a second. And this is like the patient will come in with like a rash after lipo, and like some respiratory failure, and unfortunately the only way to treat that is supportive care, like giving them fluids, watching them, monitoring. There's no way to like take the fat out of the small vessels that it went in. So liposuction is not without its complications. Like I said, whenever I do it, and it's funny, it's one of the procedures I'm probably the most comfortable with because I have done a lot of liposuction cases. At this point in my plastic surgery training, I'm a PGY5, but I am always mindful of like things like perforation and like not creating contour deformities. So for me, it's something that I take very seriously. But, you know, living in Miami where people are like, I'll do lipo for like $1,000, and, you know, you see people get mutilated or sent to the ICU. It's really unfortunate, but it's important to be aware of those complications. So that's pretty much the gist of liposuction. To me, it's pretty simple in terms of how you do it procedure, which is why, you know, I would have never thought to make a video on it. But if there's something that I missed or something that, you know, you need more clarification on, I'd be happy to answer. Just put it in the comments and I'll do that. But now let's get into BBL because that kind of goes hand in hand with liposuction and everyone seems to be getting one. So let's get to it. What is a BBL? So BBL actually stands for Brazilian butt lift. This is a term that was coined years ago, but from a medical standpoint, it is liposuction with fat grafting to the buttocks. So what that means is we perform liposuction, which I've just spent most of this video talking about, and then we actually take that fat and we put it in syringes and then we inject it into the buttocks to give it that round, juicy shelf layer. In Miami, a lot of women don't like what they call the hip dip, so we'll inject there. But that is what a BBL is. Now, why is it important to talk about BBLs? Because training in Miami, being in Florida, people see us as like the BBL capital of the United States, but we're also known for the complications that result from that. So years ago, when people were doing like BBLs all the time, they used to inject the fat into the muscle. Well, that was causing embolisms and killing women. So we have since learned not to inject it into the muscle, but it's still dangerous because, you know, fat can actually migrate down and then go into vessels. Also, depending on what cannulas that you're using, those can actually shear through the vasculature. Fat can get into that, and then it still causes the embolism, which can lead to death, unfortunately. So a BBL is a pretty simple procedure. It's not anything huge, but a lot of times when people say, oh, I'm going to get a BBL, you have to explain to them, because you'll say, oh, you have liposuction, and they're like, no, I don't want lipo, but you have to explain that it involves liposuction to remove that fat and then transferring it to the buttock area. So that is what a BBL is. And there's actually, since we're still on the liposuction thing, there's actually things that you can do. If you actually lipo the top of the buttocks and the back really well when you're doing like a 360 liposuction, which is just front to back, that's what 360 means, you can actually give someone the appearance of having a BBL without actually injecting fat into them. But yeah, so I mean, not much to say about BBL except you're just taking that fat and injecting it back in. Now, I know there's a thing about BBL smell, and typically, you know, I've dealt with a lot of patients who have had a BBL. If there is a horrible smell, that typically comes from like the fat necrosis, and that's just like there's so much fat there, or it's oozing out and it's, you know, it's dead fat, so it has a horrible smell. But having, you know, examined a lot of patients, I would not say that every woman who has had a BBL has BBL smell, but it can happen from fat necrosis, bad technique, infection. The body is really good at encapsulating infection, but there might be a smell there. So that could possibly be what the BBL smell is. I know I mentioned it to one of my attendings before, and they were like, there's no like publications on that. Maybe we should write one. But that's pretty much it with BBL, but I'm happy to answer questions on that. And one thing, the next thing I want to get into is like who should get liposuction. So let's talk about that. A lot of patients talk about wanting to get liposuction, but a lot of these patients aren't the right candidate for having a liposuction. And what I mean is, you'll have women who have had multiple children, and they're dealing with, of course, excess fat in the abdominal area, but also it folds over, so that there's rolls and everything. And I think what people should realize is, when you take that fat out, if you don't have good skin laxity, snapback of the skin, that skin's just gonna wrinkle or fold over, and it's actually going to look worse. So I always say, when it comes to liposuction, you do really need a full consultation by a plastic surgeon, hopefully in person, so that they can evaluate your skin turgor, laxity, how that's doing. Because the worst thing I see is women who are adamant that they don't want a tummy tuck because they don't want the long scar, but then they're adamant about getting liposuction, so they get the liposuction, and now they're left with all this loose skin that just doesn't look good, and they have to go get the abdominoplasty. Now, a lot of times you can do the liposuction with the abdominoplasty, so that would have saved time, or you can do it after. But a good candidate is typically someone, you have fatty areas, but your skin, it's a good snapback. It's not for me, for example, I've had a kid, so no matter how small I get, when I bend over, you see the skin go back. Now, there's ways to tighten that, but chances are high, if I just got lipo, there would still be some residual sagging skin that would probably bother me more so, and I would just end up needing a tummy tuck. So that's just something, that people should be aware of. But I think that pretty much wraps up liposuction in a nutshell for the general public. Like I said, this is not super educational, but what do you want to know? Let me know what you want to know, and I can cover it. But I hope that this answered some of the most common questions that I get about liposuction. So that concludes this video on liposuction, with a little aside on a BBL. If you like what you see, please subscribe. I'm happy to answer any questions you have in the comment section, or let me know what videos you want more education on, and I'd be happy to do it, because it's important that the public is aware, what we do as plastic surgeons. So, I tried to avoid doing aesthetic first, but I'm happy to talk about aesthetic surgery, as well as all the aspects of reconstructive plastic surgery. And I just want to say thank you guys for watching, and until next time, have a great day. Bye.